All right, we'll do our first mic check. Check 1, 2, 3, 4, 5. And over here for questions, check 1, 2, 3, 4, 5. All right, we'll do one more mic check. Check 1, 2, 3, 4, 5. And over here for questions, check 1, 2, 3, 4, 5. We'll get started in just about 5 minutes. All right, we'll do one more mic check just to make sure our Facebook page has audio. Check 1, 2, 3, 4, 5.
Good Thursday afternoon. I'm Dr. Martha Buchanan, Public Health Officer and Senior Director here at the Knox County Health Department. Yesterday, we dedicated our moment of gratitude to the KCH team who is working our public information line. Today, we want to expand our moment of gratitude to include all of the KCH team members who are working our COVID-19 response. More than 140 people from the health department are involved in in aspects of our response. We'd like to spend a little bit of time highlighting these individuals today. Our epidemiologists and their teams who are conducting case investigations, monitoring and contact tracing, as well as data analysis. Our emergency preparedness team, working with community partners on the response, while also assisting with the planning and execution of our testing events. Our environmental health team, who is working with businesses to provide education that focuses on safety for both employees and patrons. This team has also played a part in working our testing events. Our business reopening team, including KCH staff and community partners, working diligently to ensure proper guidance is available to our community as we look to transition from one phase to the next. Our clinical team, who is working directly with patients, testing, educating, and being a friendly face for folks who are in the midst of scary and uncertain times. Our Joint Information Center, comprised of KCHD and partner organizations, ensuring coordinated and consistent messaging is being shared internally and externally. And that's just a scratch on the surface. Over the next couple of days, we will continue talking about the incredible effort that's underway between KCHD and the many community and governmental partners that have stepped up to the plate during this pandemic. We are extremely grateful for each and every one of you. Today, KCHD will be offering free testing in the Lonsdale area in a walk-up and drive-through model. No appointment is necessary. It will take place between 3 and 6 p.m. at the Haslam Sansom Emerald Youth Foundation Lonsdale Ministry Complex. This is part of the targeted testing that we are doing on Tuesdays and Thursdays to reach high-risk individuals or those who may have less access to testing. Moving on to the local situation. We have 305 confirmed cases of COVID-19 in Knox County. You'll notice this is fewer confirmed cases than we had yesterday. Through our investigation, several cases were transferred out of our jurisdiction because these individuals are residents in another state or county. Just as a reminder, this is a common practice. Our local team investigates cases and determines whether they need to be transferred to another jurisdiction based on residence. Additionally, we have 3 probable cases. 233 of our cases have recovered. 37 individuals have been hospitalized at some point in their illness. Only 1 is currently hospitalized. Again, we are thankful today to report no additional deaths from complications from COVID-19. Now I'd like to spend some time talking about antibody tests. We've received a lot of questions about this topic, so we'd like to give some background. Antibodies are proteins that help you fight off infection. They are produced to fight specific germs. However, it takes time for you to produce the antibodies. In addition to that, antibodies for similar germs have similar qualities, making them hard to distinguish from one another. It's something called cross-reactivity. So you might have one COVID virus and test positive, or coronavirus and test positive for COVID-19. Those 2 last facts, the time between illness and antibody production, and the possibility of cross-reactivity between COVID-19 and other coronaviruses, make the current antibody test not reliable to be used in determining if a person currently has COVID, has had COVID, or is immune to COVID. Even the current antibody tests that have been approved through the FDA's emergency use authorization have not yet been validated to be used in clinical practice and should not be used in patient care. The current gold standard, you've heard me say this before, the current gold standard for diagnosing new COVID-19 infections is the test that looks for the presence of virus in your nose or throat. So swab in your nose or throat has to be done in order for that test to be performed. And now I'll open it up for questions.
All right, the first question from WATE, I believe, was just answered in Dr. Buchanan's talking points. So if you have any follow-up questions on that, feel free to type that in there. From WUOT, on Monday, you said KCHD had voiced concerns to the state about local law enforcement agencies having access to the COVID-19 patient database. Since then, KPD opted out of access, but the Knox County Sheriff's Department opted in. Do you have any concerns about this? And if so, have you discussed it with the County Sheriff's Department?
We do have concerns about law enforcement having information about patients. It's a decision that was made by the state, and the state is sharing that information with law enforcement. We are not sharing any information with law enforcement except in very specific instances. And so it's certainly a decision made by the sheriff. I'll be honest, I haven't had a conversation with him recently about it. We have had conversations in the past, but haven't had one recently.
From WVLT, are you able to give an update on what could reopen in phase 2 and what other changes would happen in phase 2?
That plan is still in process of being created. Actually, what we're doing right now is we're looking at all of the input that we got from businesses so that we can pull that together and use that as we develop our plans. We hope to have those out soon, but that plan is being created.
From WBIR, what input did the health department have on the new graduation plan? Do you approve of it, and what have your recommendations been?
We provided Knox County Schools with the community guidance that we have. They also have the guidance from the Tennessee Department of Education that they use to create their plan. I honestly haven't seen it yet, but I know that they make thoughtful decisions and want to protect their students and their families.
Follow-up question from WBIR. If COVID numbers don't improve in the way we would like to see, will you recommend the old plan?
Well, I think if COVID numbers don't improve the way that we would like to see them like they are now, we'll have to go back and have a conversation with the Board of Education and the superintendent and the mayor and make decisions based on that.
From WVLT, can you give us an update on how phase 1 is going?
Well, somebody remind me the time frame. We're just barely 2 weeks into phase 1. And like we talked about before, we need to wait some time to see if we're going to have an increase in cases. It's too early to tell that right now. That's why we recommended 28 days being each phase at least, so that we can see that. What I can say is that the businesses that our staff has had to talk to, they're making the changes that are needed. They're doing the things that need to happen. They don't want to make people sick. They want to keep us moving forward. So we're pleased with that. We're pleased with how people are asking questions and cooperating. So the majority of people are doing the things that need to be done to keep us moving forward. And, as I've said many times, that's what it's going to take, is all of us doing all of those things, the five guiding principles, I think is what we call them, or practices. Washing your hands regularly, maintaining social distancing, wearing a face mask when you're in public, disinfecting things regularly, and staying home if you're sick. If all of us do those things, we are more likely to be able to open things up a little bit more in phase 2.
From WATE, do you have an update on the plan for public housing test events, the 6 slated for this weekend?
Sure, I do. Thank you. So on Saturday, the 16th, testing will be done from 11 a.m. to 4 p.m. at Cagle Terrace, Isabella Towers, and 5 Points. On the 17th, from 10 a.m. to 3 p.m., Love Towers, Northgate Terrace, and Montgomery Village. So that's a partnership between the National Guard, KCDC, and the Knox County Health Department, pulling together to target test those folks. So these testing events are really for the residents of these facilities and not open to the general public. Just want to make that clarification.
From WBIR, the state will likely hit a major milestone in testing today or tomorrow, 300,000 tests. Where is Knox County at in terms of testing? When will testing be available 5 days a week?
Testing is available 5 days a week. I remind everybody, one, that we're not the only group testing. Doctors' offices, urgent care centers are testing as well. We're testing in a drive-through fashion 3 days a week, and then the other 2 days we're doing testing in other areas. So testing is available 5 days a week, and people can get access to testing as they need it.
Also from WBIR, yesterday you told us about a third of the masks have been picked up so far. Have pickups slowed down, and are there conversations about handing them out in other ways?
So first of all, I have to correct the number that I gave yesterday. I gave a much higher number than we gave out. And I think we've given around 7,000, we've been 7,000 distributed by us, and about 6,000 were given to partners to give out to other folks. And we continue to give those out. So you have to remind me the question, because I got.
They've asked if pickups have slowed down, and are there conversations about handing them out in other ways?
So constantly conversations on how to hand them out in different ways, because we have a lot. And so I don't know if pickups have slowed down. I'm not getting an update daily on how many we distribute. We did change our distribution times to be noon to 4:30 in the afternoon. We looked at our data and most people were coming to pick up a mask in the afternoon, not in the morning. So we made that change so that staff can do other things in the morning.
Their other question on this topic is, are more of these masks on the way?
Well, we actually got more. We got several, I think it was over 40,000 more sometime this week delivered from the state. So we'll continue to work with partners to get those out in the community. We want them out in the community. We want to distribute them. And so we'll do that in different ways.
From News Talk 98.7, they're asking specifically, what concerns do you have about the sharing of COVID-19 positive patient info with law enforcement agencies?
What we've heard from the community is that some people in the community are concerned about how that information will be used by law enforcement. So they have personal concerns. So we've heard that from our community, those are the community's concerns. And we've had those concerns in the past in sharing patient information with law enforcement.
From the Sentinel, will you / can you send out a news release with the information on the testing locations this weekend?
We're reaching out within those communities. Again, the testing events this weekend are really just for the folks who live in those facilities that I named. And so we're actually working directly with KCDC to get information out to the people that are going to be tested this weekend.
From WBIR, referencing the graduation plans and COVID numbers not improving, what would the timing / benchmarks look like that would make the more open plan recommendable?
So right now we plan on moving into phase 2. Our numbers continue, our growth rate of new cases continues to be very flat. We'll know more next week. Our testing testing continues to go up. Our hospital capacity continues to remain positive. Our capacity continues to remain positive. So all of those things are pointing in the direction of continuing to open things up. Again, we'll just have to look at the numbers and the data and all of the different factors that we have to consider and have conversations about what's next if that's needed.
From WUOT, earlier this week, Shelby County Health Department reported a spike in opioid deaths since the start of the pandemic. Has Knox County seen any similar or concerning non-COVID health trends in recent weeks?
Actually, we haven't seen any. I haven't heard anything from the medical examiner's office. We unfortunately continue to have opioid-related deaths in our community, just like we continue to have deaths for many other things in our community. Just because we have COVID-19, all of those other things that were challenges for our community health-wise continue to be challenges. Access to care, opiate abuse, obesity, all those things continue to be a challenge. Our primary focus right now, of course, is COVID-19, but those all continue.
From WBIR, we're hearing that some patients are being told by their physicians based on symptoms to assume they have COVID and are not being tested or placed on the counts for COVID diagnosis. How can the counts be accurate if this, quote, assumption diagnosis is taking place?
So first I've heard of that. Certainly clinicians have the ability to decide that a person has an illness and give them a diagnosis without testing them. And those folks would be seen in looking at some other surveillance like COVID-like illness surveillance possibly, or other surveillance that the state Department of Health would have access to.
Any other questions? Please go ahead and submit them now into the chat feature. From WATE, are the patients tested before elective surgeries in Knox County included in the case totals?
If they're positive, yes.
And their follow-up question was, have some of those people tested positive?
We are not tracking that information in that manner. The hospitals will be tracking and making a decision about whether they allow somebody to proceed with a procedure or not.
Any other questions? Please go ahead and submit them now. All right, since there's no more questions being submitted into the chat box, we'll log off for today. Thank you all for joining us, and we will see you tomorrow at 12:30.